Interesting question. I'm 70 years old, and throughout my lifetime, I've lived in a great many cities and was fortunate to have a number of good doctors. But I can honestly say that not one of them comes close to the quality of care and skill of Dr. Shaw. The way that I found my way to Dr. Shaw and to deal with my cancer was in Los Angeles. I had a urologist who saw that my PSA levels were like 10 and 11. And he said, nothing to worry about to me. As long as it doesn't go any higher, you'll be okay. We just look for fluctuations. And I thought, God, they say in the books that, it shouldn't be above like 4, or 5. For years, I went along with a very high PSA. When I came to Texas, and the first urologist I found turned out to be quite incompetent. So I had to seek a second urologist, and my family doctor said, Dr. Shaw, no question. Don't even look beyond, just go immediately see Dr. Shaw. He's brilliant. So I made an appointment and I saw Dr. Shaw. In my first discussion with him, he said, so you say that, this level, your PSA level's been this for years? And I said, yeah. And he went, this is outrageous. He said, you're going in for scans tomorrow. He said, there's a problem here. And, I was shocked because I'd for years taken the advice of the previous urologist that wasn't anything to worry about. But went in, got the scans done. Next follow-up meeting, Dr. Shaw said, okay, the bad news is you've got cancer and it's growing. The good news is we have a good chance if we go in right away and get it out. And we'll use the Da Vinci robot system, and our success rate is quite high. I'm quite confident that, we can achieve our 3 goals in the operation. I had the operation. He did achieve the 3 goals, which is cancer-free, continent, this is an odd word, continent, and functional, right? And so really by all measure it was a success. And he said, well, just keep meeting every 6 months and we'll watch that PSA. And if it starts to climb again, then the next step would be radiation, right? And he said that has its benefits. It also has its cost, its price. But, I think we'll have success then too. So he was always very positive. He's one of the most cheerful doctors I've ever met. The interesting thing is, I wasn't experiencing any symptoms that made me think I had cancer. I didn't feel sick, I didn't feel lethargic. So I really didn't know, because it's like cancer, the silent killer, right? I really didn't know, except, again, as I say, those high numbers. And when Dr. Shaw saw them, he went, you have cancer and you've had it for quite a long time. I'm sorry to have to deliver the news. So I honestly didn't feel any symptoms or any negative effects. And afterwards, other than feeling psychologically, almost euphoric, hey, we got it out, that's great. I just feel more grateful, for good health. And I blame Dr. Shaw for that. And the whole procedure from start to finish was really easy, thanks to the doctor. He spoke to me very clearly. He explained everything he was going to be doing, and everything I might experience afterwards. Luckily, I didn't have any after effects that were, uncomfortable or worrisome. And really, I couldn't imagine finer care from a urologist. Yeah, I would say the moment that I went in to see him for the post-op results, and worrying, is he going to say, couldn't get it out, sorry, but we're going to have to go into radiation, or I'd try a second operation, which is I think is not really normal to do. So I would say that the brightest moment through the whole procedure was the day that I came into his office, and he gave me the results of the surgery. Plus, he took more X-rays right afterwards, and he said, "We got it." That was just like a huge relief, and I still feel that relief and gratitude to Dr. Shaw for that. I would say to any younger men, have your PSA level checked by your family doctor as part of your regular. See a doctor at least once a year for a physical, and at that physical, make sure that the doctor checks your PSA levels, because some doctors don't. They just don't include it. If there's no discussions, they don't include the test. Have your PSA levels monitored regularly, and if they're healthy, fine. And that way, if every 6 months is best, but every year at least, you'll know that your PSA level is fine, and that's the indicator. That's the one genius thing they've found out in the blood that says, you got cancer cells in here somewhere. See your doctor once a year, make sure your PSA levels are on the blood test, and watch those. Because the moment they start to tick up, that's when you go and see a urologist. I can't thank Dr. Shaw enough. Honestly, if I hadn't met him, I probably at this point wouldn't be sitting here to talk about my story.